It's Thursday, August 6th, and it is my son's 16th birthday. So I wanted to wish him a happy birthday, though he is not actually watching the meeting. We do have a quorum, so I will call this meeting to order. Due to the current federal and state emergency declarations, the Minnesota directive to residents to stay home, and the guidance about limiting person-to-person contact due to COVID-19, this work session of the Edina Public School District School Board is being conducted online in accordance with Minnesota Statutes 13D 021. Persons may monitor this meeting from a remote location by using the district's YouTube channel. School board members are reminded to mute their microphone or phone when they are not speaking. School board members wishing to speak should unmute their microphone so I can see who is waiting to speak and then wait to be recognized by the chair. I will determine the order in which board members wishing to speak will be recognized. Tonight, the district leadership team will discuss planning for the 2020-2021 school year to date. They have provided the board and community a comprehensive update on planning to date and next steps. I would first like to commend you and your leadership team on the work you have done to get us to get the district to this place. I also want to acknowledge to the community, staff, and educators that this is a very stressful and anxiety-provoking time, and we realize there are still many outstanding questions to be answered. We're hoping to get some of these questions answered tonight, and please know that we are working as fast as we can without sacrificing quality to get information to you. I also want to acknowledge that there have been a number of questions raised regarding the process in place for providing school planning information to the community and the board's role in that process. As everyone is aware, the district was not provided guidance from the state until July 30th, with a planned start date for school of August 31st. This left the district with very little time to put together a proposed plan and provide it to the community. In addition, the changing numbers regarding COVID makes it imperative that we seek additional information from our families and teachers regarding their comfort level going forward as we try to put together a schedule for beginning the school year. Given these parameters, the decision was made to put together a proposed plan and get additional feedback from our families and teachers based on this plan. The Governor's Committee has been meeting and discussing processes to try to help guide the administration on how we can balance the sense of urgency we have as a district to communicate information to the community in order to get accurate numbers from a staffing and student choice perspective with the need to meet and discuss issues as a board. Knowing we had this work session planned for tonight and we are working under such compressed timeframes, I agreed with the decision to have the district send out information to the community regarding the school year prior to the meeting. By doing so, we've provided our community with additional time to process the proposed plan while still providing the board with the opportunity to discuss the plan tonight. As board chair, I take responsibility and ownership for any questions or complaints about this process. I'll now turn it over to you, John, so you can start walking through the board and the community with the update on the 2020-2021 school year plan to date.
Thank you, Chair Ellenberg. I'm just going to introduce the staff that are here. Andy Beaton from the high school, Chris Holden from Normandale, Jeff Jorgensen from special ed, Jody D. St. Hubert, Director of Teaching and Learning, Karen Bergman from Countryside, Katie Mahoney from Highlands, Principal at Highlands, Leah Bird, Early Childhood, Lisa Hawthorne, Early Childhood Special Education, Mary Hyman, our Health Coordinator, and Mary Whitey, Communications, Mike Walker, Technology Integration, from Human Resources, Rachel Hicks from Childcare, Randy Smazel, Assistant Superintendent, Sean Dudley, Middle School Principal at Valley View, Steve Butner, Technology, Troy Stein, and Athletics, Val Burke from Community Ed, and our trusted technician, Zach Horn, is running our feed tonight. So tonight we are presenting the hybrid model for Edina Public Schools. As you know, the governor put out the Safe Learning Plan last Thursday, and under that plan, the case rate for Hennepin County, they are having us determine what our our model will be based on the number of cases per 10,000. On last Thursday, July 5th through July 18th, there was 20.93 cases per 10,000, which put us into a model where both our elementary and secondary would be hybrid. We are also to provide a distance learning, which we are calling Edina Virtual Academy. So that's our distance learning option. We just have renamed it. And just to let know that the number of cases per 10,000 in Hennepin County, according to the Department of Health, has gone up to 23.24, and that just came out today. So we are building our model based on both our elementary and our secondary being hybrid, and also offering our families a distance learning or a Edina Virtual Academy choice. So tonight, what we're going to present is we're going to start by having, we have our health professional partner from Bloomington Public Health, Nick Kelly, here to talk to us about a little bit about the virus itself and remind us about what's happening in public health related to the virus, and then also talk about the partnership that we will have with Bloomington Public Health as we move forward. We're also going to quickly go through buildings, some of the building considerations. Eric Hamilton will be on. Dan Hutchinson will be here from Chartwells to talk about food. Have Troy talk about athletics. Those are quick presentations. Then we'll get into each of the areas of the instructional program for the district: early childhood, elementary, middle school, high school, special ed. Jeff will talk a little bit about social and emotional learning. We want to talk about childcare, and then we'll close it down with communication. So I'm going to turn it over to Steve Butner and Mary Hyman to introduce Nick, and we'll start there.
Great. I think I'll hand it over to Mary Hyman after I welcome Nick in as well. We were put in touch with Nick last week. Nick is a epidemiologist for Bloomington Public Health and has a lot of been doing a lot of work around COVID. He does assist the cities of Edina, Richfield, and Bloomington. And more than likely, the Minnesota Department of Education talked about having a health resource, a regional resource, and more than likely, the Bloomington Public Health will be ours. And so Nick's been a great resource already, but he has just a wealth of knowledge around COVID, around the practice of testing and mitigation and contact tracing. I don't know, Mary, if you want to add any more before Nick takes over.
Yeah, the one thing I just wanted to add is the other, in addition to the COVID issues right now, we will continue to use Bloomington Public Health for our influenza flu shot clinics that we utilize their staff in the fall as well. So that's another kind of a key public health partnership we have with Bloomington Public Health.
Without ado, Nick, welcome.
Good evening. It's a pleasure to be here and working with you all on some of the most important work we get to do, taking care of our young children and making sure our staff stay safe. As Stephen and Mary highlighted, we work very closely with the city of Edina and have had a long relationship working with the school district on a variety of projects in the past, and COVID is not going to be any different than that. And so our ability as a local city-based health department, we get to work closely in this entire process as part of that regional support system that the state is setting up. We know Edina, we know our partners there, and we get to see the city level data and be able to have a bit more insight into what's actually going on in Edina, as opposed to just high level at the county level, and be able to help guide some of that decision making process as we're seeing trends, as we're seeing concerns that could help modify or change the decision making process once school is in place and prior to school starting, as you decide on your learning module. we're also available as part of that process to work with the district and assist in any decision making or risk assessment process as you're going through learning modules or processes, and trying to be that second, third set of eyes to help guide any concerns from a health standpoint with our partners at the state and the Department of Education. So those are some of the things we can do. And as part of that process, as cases occur during the school year, we'll be in very frequent contact with Mary's team and working through that case contact investigation process to make sure that anybody that's been exposed and needs to be put into a quarantine process that can be done very quickly and safely to protect our students and staff, and also minimize the ability for an outbreak to grow inside any kind of school setting. So that's just kind of high level of kind of some of the help we can do on that end. I didn't know if there were specific questions about the process or how that process actually works.
So I think this is the place, Eric and I talked earlier that maybe for each of these topics, we just stop and take the opportunity to ask opportunity to ask questions, for the board to ask questions with Nick here. And I'll just turn it over to the board for any questions they may have related to public health services and the public health role in this. And Mary, I don't know if you want to say anything more about what's happening within the school system as it relates to health. I mean, there's a lot going on, but as it relates to COVID.
Yeah, Nick, can I ask you a question? So
yeah,
how does, based on our numbers and the county level numbers, how can you help the community and school board members assess the risk of a hybrid program? And, because I've had a lot of questions on if there's a teacher that tests positive or a student that has symptoms, how we're going to work together on that. So I don't know if you have I'd be curious to see. I know how we can work together, but I just want other people to hear it from your perspective, how that might work.
Yep. So one of the first things that we looked at from the risk standpoint, and in our work with the city of Edina, we're in a joint incident command process. And so every week we're providing situation reports in part to the city of Edina. And that's allowing us to look closely at our local data. And so we recently started providing case rates per 10,000 and case rates per 100,000, different metrics that are being used around the world and the U.S. to understand what's going on. What we've seen in Edina is Edina had an increase in cases. We saw the end of June, early July, and there was some flurry of activity, especially with athletics and youth activities, where we saw an increase in cases. Edina did some actions to work on mitigating that. The cases have dropped quite a bit since then. And so when you're looking at the rate of cases in Edina, they've been on a downward trajectory since then. And the case rate per 10,000 is under 15. While the county is in that low 20 range. And so the conditions on the ground, so to speak, in Edina are more favorable than the county level conditions. And so I think that should give you some confidence that, if you go down the hybrid approach, that you're actually in a better position with the virus in the community than other places within Hennepin County. And the ability to manage exposures and events in a hybrid setting are well structured. The reason the state set that plan up is if you have half capacity in a classroom, that means your potential exposure is significantly less of your students. And the ability to minimize outbreak transmissions when you're cohorting and when you're structuring those environments that way with social distancing and face coverings and all those other added measures, you have the ability to manage anything that happens at the school setting better, especially when your rates are at this level. And so, as Mary kind of hinted at, when something like that happens and when you get a case, because you will get a case, we're going to be working extremely closely with, okay, you get the lab confirmed results. We then understand, based on how the structure of that classroom or that school is set up, who was exposed, and then rapidly work to make sure that they know that they need to be home for the appropriate period of time to protect the rest of the students and staff at the schools. And so that process will likely play out multiple times during a school year. And that's something that we'll work very closely, and based on the state guidance and the process, it can be tailored to every situation. So it may just be a classroom, it may be a grade, or it may be a building. It really depends upon each individual situation. So it's hard to give a blanket answer of this is exactly how it's going to work, because every exposure, every situation is going to be a little unique. And that's part of the partnership and relationship, is we'll work through that together with you.
So can I ask a question? Is that?
Yep.
I think one thing that I think I'm trying to understand, and I think the community is trying to understand, is from a protocol perspective, if a either student or teacher shows signs of COVID, would they at that point be removed from the classroom? Or do we, I guess I'm just trying to understand sort of the process there, or do we, so are they removed, then do we wait for a positive or negative confirmation for that student to come back to the classroom, or that teacher to come back to the classroom? How does that just even initial process work?
So I can talk a little bit about the current process, but that current process on the exclusion guidance and when to keep students and staff out of a school setting is going to change in the near future, as they're working on tweaking it a little bit more, recognizing schools getting ready to start. The high level aspects are going to be the same. If a student or staff member has symptoms, they're going to be told to go home. The ability to do more is really dependent upon a test. And so if somebody goes home with a start coughing in the middle of the school day, they go to the nurse office, they get picked up and go home, they're going to be instructed to get a test. And the test result is going to really determine our next steps. And so that test result will tell us, yes, it's COVID. No, it's not COVID. It could be influenza. It could be one of about 200 other viral or bacterial things that we see that we call influenza-like illness that we see every fall and winter. And so they're trying to tighten up the exclusion guidelines a little bit more to accommodate more of that reality. So that schools are not being asked to make clinical judgments. It's a little bit more cut and dry. There's a little bit more judgment right now in the current exclusion guidance. The process would be the same. It's if you test positive, there's this pathway where if somebody tests positive, then we're looking at their close contacts. Who are they spending more than 15 minutes within 6 feet? Those people are going to go home for 14 days. If they're test negative but still have symptoms, there's a separate path for that process where they're going to be excluded for a certain period of time until their symptoms resolve. And you just basically work through that process depending upon the situation.
And so the magnitude of the impact obviously varies depending on what grade they're in, where they are in the school system, because obviously at the secondary levels, if someone is in different classes, it could affect quite a few students at that point.
It is potential. A lot of that is based on the multi-layers of structure that are put in place. So you could have a first grade classroom where everybody's being pretty good and staying, 7-8 feet apart. And it could end up being a very small exposure. You could also then have it a large exposure at a high school setting. We're not the passing somebody in the hallway when everybody's wearing cloth face coverings. That's a short time frame. And so when people are doing all these additional steps and processes that the state health department and MDE have put in place to make school as safe as possible, you have a lot of opportunity to minimize exposures. And so that's why it's really going to depend upon the individual situation and how well those protocols and processes are being followed and what actually happened.
Great. Julie?
Yeah, thanks. So I have two questions. One, you answered somewhat, and it has to do with defining exposure. And it sounds like there's going to be some more guidelines that you said are coming out from the state on kind of the process and the protocol that I would think would include exposure. Would you agree with that? Like you were saying, like, I think I've heard it said it's kind of on a spectrum, right? So you have a high level of exposure, which maybe you're in a classroom, but then a low level exposure would be you're passing someone in a hallway, right? And so is that going to be part of the guidelines that you're expecting to see in the protocol, more definition of what exposure looks like?
Yeah, what we're expecting to see is more clarity in some of the exclusion guidelines. Okay. I don't think exposure will change much. It used to be a different number. It's been pretty consistent now that if you're within 6 feet for more than 15 minutes, that's an exposure.
And that's only one level. It's you're exposed or you're not, or is there a spectrum?
The way we're looking at it from the public health end is yes or a no. It's okay. A binary. So, yep, it's possible to have a variety of exposure, but you set up a process that works for population level.
Okay, great. Thanks for clarifying that. And then my second question is about testing. So it's kind of two parts. So in the announcement from the governor, they talked about a saliva test, that all the teachers were going to have one saliva test and the results would come within 24 to 48 hours. Is that what would be seen, that if we have a teacher that is tested, that we would get those results within 24 to 48 hours? So that's the first part of that question. The second one is, have we thought or looked at doing some proactive testing? So for example, everyone coming to school, everyone coming, make sure you have a negative COVID test before you come in. I know it seems like a huge ask, but I think there are colleges that are doing that and are expecting that. I just am trying to see where is the proactive piece in determining the safety of students more than a at-home screening to really ramp, to bring it up a level. Is that even a possibility? No.
So the first part, the saliva test, any positive test result that comes back in the state of Minnesota is required by state statute to be reported to the state health department. Right. And so those results will get reported into a central system that we work with the state on. And so if a case comes in that way, somebody in local public health will reach out and contact that individual and do a contact investigation. In that process, we'll understand about their employment status, or, they're a teacher in the Edina School District. That'll trigger additional steps in that process. So yes, we'll find out as soon as it gets into the system, and it'll get queued up, processed that way. And we work closely with the state on that aspect. As far as the proactive testing, there's been a lot of discussion and look at that from the logistics and sustainability and process standpoint. Our approach has been to look at ways to do more. If something's happening, find a way to test well in that area. We don't have a whole lot of insight right now about the value of doing broad testing with PCR based testing, the molecular testing we're doing when somebody's asymptomatic. And so we the value of that, it'd tell you at that point in time, we weren't able to detect the RNA for SARS-CoV-2 in that individual. But that afternoon, they could become exposed. And part of the concern with doing blanket testing is some people can make an assumption I'm good to go because there's no concern, there's no risk because I don't have it because I got tested on Monday, but you were doing some things that you probably shouldn't have been doing and you got exposed on Tuesday and you start developing symptoms on Friday, but you think because you got tested on Monday and you were negative, oh, it's just something else and don't worry about it. So we don't have plans for that blanket testing, and that's not something that we're really seeing happening here in Minnesota, especially at this level. It's happening at some aspects in critical infrastructure, but it's not happening at the education level here. Part of that's testing, supply chains, logistics, because if you're going to do that, you'd want to be able to do it on a repetitive, consistent basis with a representative sample.
Absolutely.
And that, with some of the challenges we're seeing right now, nationally and internationally, with some of the key components of the supply chains for testing, that would be a hard thing to pull off.
Okay. And I had asked about like the turnaround of those tests. How confident are we that those turnarounds would be between 24 and 48 hours? Because I think that has a huge impact on the longevity of someone quarantined.
Yep. So those
we don't know yet, but I want to be real honest about that. So
those are likely going to be asymptomatic tests. So you're likely not going to have a bunch of symptomatic teachers doing the saliva test. The state has told us they feel pretty confident on the turnaround. The difference with somebody symptomatic and getting a negative test result and then being asymptomatic and getting a test result that's negative, they're treated a little differently. If you have symptoms, we don't want you in the workplace or the school setting until those symptoms reside, regardless of your test result.
Okay, thank you.
Matt, did you have something to add to this point?
Yeah, just on that point, I really like your thinking. I am not super confident in the false negative rate of some of these tests in these early stages. So if we were to consider using them as a barometer that says, if we tested some people and they were not positive, that makes it safe, that's not actually a very confident read-through. So I think we should be waiting a little bit longer to think about any kind of broader testing to make decisions off of from that perspective. So I think this is really good thinking. I was concerned about if it went the other way.
Thank you. Ellen, I know you've been waiting, and then I have you, Owen, too. So, Ellen, do you want to go ahead?
Yeah, and I'm curious a little bit about what Nicholas would say about face masks. And I know that we have some requirements for face masks as a mitigation method. And I'm just wondering, what does the state say with respect to requiring face masks?
The executive order, it was a recommendation to have all students and staff in schools wear a cloth face covering. The executive order made it a requirement. And so it's very clear in the guidelines that everybody is expected to wear them. The state is going to be providing cloth face coverings and some additional protective equipment to every district in the state as part of that process. And as far as the safety and the value, if every student and staff member and teacher are wearing a cloth face covering, and teachers are going to be, at the state level, they're going to provide face shields for teachers and a good portion of the support staff. Wearing a face shield and a cloth face covering or a surgical mask, that's the same thing that the surgical mask and a face shield is the same thing they're wearing in a healthcare setting. That's very good. From a protection standpoint, the face shield is going to allow for a lot more of that education where you're teaching kids how to read and spell, and they can see your lips move, and adds a huge value to that aspect, while also providing some source control. And we see the face shields do provide some aspect of actual protection to the user too.
Okay, and I understand that I've read, but and so one of the questions I have is, I'm sorry, I was hearing someone else. Was so we will not have any exceptions. Edina will not have any exceptions to wearing face masks. Is that right?
My understanding is we will have exceptions for students that are in special education and cannot, for various reasons, have a face mask. But beyond that, it's required.
Yeah,
For health reasons, students can't have masks over their face. So,
And Troy, if I'm not mistaken, athletics also during their practices and workouts, they do not have to wear masks. Is that correct, Troy?
Yeah, that's correct. So when they are in a position of working out, they do not have to wear a mask.
Yeah.
And the Minnesota chapter of the American Academy of Pediatrics has also come out with a statement that said, there are limited accommodations for not wearing a mask for the, there are ones that have been mentioned here, but, there might be some other medical issues, but we would be requiring, sort of an exemption letter or notation.
So I'm just going to. My concern is that we want to keep all students safe. And what I just heard from Nicholas is that the governor was saying that this was a mandate for all buildings. And when students are not wearing a mask, you're putting other students at risk. So, and we have a distance learning option. So I'm just wanting to make sure that I understand both sides. I understand that some students can't wear a mask, and that those students, though, should not be putting the whole district at risk. I'm just wondering if Nicholas could talk to that.
Yeah, so as everybody's articulated, there are some exemptions, and part of the process and the planning that every district's been asked to do is find ways to make accommodations in structures. So there may be a student that cannot wear something, and there's different processes that can be done to make those accommodations and increase the safety and the well-being of individuals in the school and that student through that process. So in some of those cases are processed on kind of an individual level. If you have a student that has high risks, there's clear guidance on the state side for how to provide for safety for the staff providing that direct service to the student and support that environment in a safe as possible manner. But that does not what we see is if you have, an individual that can't do that and they're in a large group, if they're maintaining that 6 feet of distance, that's the most important thing. And so the social distance aspects are throughout all the plans and requirements. And so first and foremost, that's the most important thing to minimize spread inside a school setting. All the other layers are things that you add on to try and add multiple layers so that you're doing everything possible to minimize those risks. For the staff that might have to be taking care of or supporting a student that has an inability to wear a cloth face covering, they're going to be wearing a little bit different PPE or personal protective equipment to minimize any risks on their end.
But wouldn't then all students that come anywhere near that student need the same amount that you are just saying the teachers would need? I mean, I don't understand. I actually, I've been on a Delta flight where they literally turned around the plane because someone took off their face mask.
Yep.
And I'm just saying on a district level, when the district has an option, that could be the accommodation for students that are unable to wear a face mask, mostly because I'm looking at trying to make sure that we have our schools open for all students and the transmission is being mitigated in as strong a way as possible so all students will be safe. And knowing what we know about face masks, it just seems as if we have some loophole, it puts all people at risk.
I don't think there's a loophole that you say, Ellen, and I think the problem with what you're suggesting is the majority of students that would fall in that category also fall into the category of students that are in special services and need the most hands-on attention that we're most concerned about when we were doing distance learning. And I think that all of these situations need to be dealt with on a one-on-one basis and through these mitigation factors. And from my perspective, I'm not comfortable saying if you can't wear a face mask, then you can't come to school, because I think that would be excluding some of our most severe needs students.
So are we going to be requiring a medical exemption?
I think that if we're given a medical exemption, we would have to honor that. I would assume, Mary, wouldn't we? If there was a medical reason for not wearing a mask, they couldn't wear a mask. Mary?
Yes.
Yeah.
We would be honoring that. And the other thing is, it's the multi-layer approach. And, what that means, it's, like Nick said, it's social distancing. We're doing the passive screens where we're expecting people to come into school. They're well and ready to go. They don't have symptoms of COVID. We're doing the hand washing. We're providing any other sorts of masking or, face covering, that sort of thing. So it's not just going to be one thing in line. It's going to be all of those things that need to be ready.
Yeah,
So
I understand that. And my real intent is to understand how the district is going to create these policies and have the safest experience for all of our students. And I just understand that there is a anti-masker contingency out there. And so if our policies don't include something like the need for a medical exemption, I'm not sure how we will be able to operate with consistency and integrity.
So I just need to address that a little bit from a special education standpoint, Ellen. One of the things that, excuse me, Ms. Jones, but there is a concern about, if the school district is going to require that, especially in the case of special education, that's an evaluation type of a model. And if the school district requires that, we may also be required to pay for that in order for students to get that exemption from their physician, especially in the area of special education. And the other side of it is that it's not always a medical exemption. Sometimes it is also a developmental exemption because the students developmentally don't understand the rationale for masking or can't keep that mask on for a long period of time because they're just developmentally just not understanding the why of the masking. We're taking every precaution from a special education standpoint to ensure that those students learn those regimens and asking parents to join us in that. But it is something that we are taking the utmost caution in.
Sorry, do you have something directly related to this, Matt, or can I move to Owen?
Directly related, just to clarify for math, there is no age break either way, including when we think about early learning centers, part of the overall capture. what is the age? Because I've gotten that question many times. Do 2, 3, 4, 5? What if a 5-year-old enters kindergarten? It's supposed to be 5 and above or 6 and above by different guidelines. You just make a very clear statement about that, just so everybody's on the same page. That's just one clarification, I think, before we move on.
Yeah, the executive order requiring it's 5 and under are exempt.
Yep.
It's recommended over the age of 2, but 5 and under are exempt from the requirement.
The other piece, I'm just looking at what we've got on the website, the specific language that talks about anyone who has trouble breathing or unable to remove the face covering without assistance, or anyone who cannot tolerate a face covering due to a developmental, medical, or behavioral health condition.
Okay, thank you. Thank you for reading that, Mary. That does clarify a lot, and thank you also, Jeff. It's my biggest concern is, there are kids that won't want to wear masks, and there's families that don't want to wear masks, and so we know that this really does impact the health of the whole school. And I'm just wondering if you could speak to what happens if a kid just takes off their mask. Will they? What is the district's plan for that?
Well, I can maybe comment a little bit. One of the things that we have talked about with the elementary principals is that, once they've got their group of students together, the group of 10 or whatever the capacity is, and everyone is social distanced, and all those other sorts of things are done. It could be appropriate to say, okay, we're going to have a mask break. You get to take your mask off, or maybe you get to put a new mask on or change your mask. That's going to be at the discretion of the teacher who knows his or her students quite well. And then that can be done developmentally. That will be part of the education that goes along with the social emotional pieces of life and times of during a pandemic and the elementary life level. Those are the sorts of things that I think are very appropriate to work with an elementary school. Just the other day we were somewhere and there was a mom that was working so well with her little 6-year-old about, well, here's another mask. This one might be better for you right now, to give some options of masking, because it's not an option not to wear it. So those are the sorts of things that we'll include in our training this fall.
Well, can I just address the mask break? I mean, that kind of defeats the purpose of having a mask.
Well,
other districts are specifically prohibiting mask breaks because of the reason that you're wearing the mask takes precedent over giving kids a little break and then breathing on each other.
Nick, can you speak to that? I've seen in person what a mask break looks like at our childcare facilities, so I know that there are safe ways that it is and can be done. So if we had a classroom, if we had 10 students and they were socially distanced, should we be worried if kids are spread into different areas in the classroom if they took a 5-minute mask break, if that was something that seemed appropriate for that age group?
So I guess I want to reiterate the masks are a second, third, fourth layer of protection in the process. Mm-hmm. And so there are exemptions for when you can remove it or not have it in certain settings and process, eating, drinking, certain activities. But it always needs to be done in that context of, are you socially separated? Are you more than 6 feet apart? Are you doing this in a context with other layered levels of prevention? And there's also guidance in the executive order that talks about some kids may have a challenge wearing a cloth face covering routinely, and encouragement of, what about trying a face shield for that kid, and the process that way. face shields don't bother your communication as much. And there's recommendations and suggestions that way to try and minimize risks. But just keeping in mind, the cloth face coverings are something we focus an awful lot on because it's a tangible, visible thing. It's down on the list of things that we're trying to do from a public health standpoint to keep our students and staff safe. There's many other things, especially that 6 foot distance, that have a much greater impact. And it's an added level of protection that we're trying to do to make sure people stay safe.
Thank
So
you.
I think from a timing perspective, unless there are any more questions about face masks, clearly there's more work that needs to be done in granularity where we need to get into this. But we also have a lot of other information to get to. So Owen's been waiting to ask questions, and I want to make sure that we can get to Owen with your questions.
Okay, thank you, Erica. Just a final comment about face coverings on the bottom of page 9. The mandates and exceptions are specified, so they repeat a lot of what Mary just read for us, just FYI. My question gets back to the documented exposures issue that we had talked about. And I'd like to get a sense of scale as to our range of actions we would take in a worst case scenario. Imagining that we had an exposure of a broad radius, a lot of kids or faculty were somehow exposed to COVID by someone in the district. Would we potentially get to the point where we would shut the school down? And if we did, I would like to talk about that later on in the meeting. So if that is the case, I'd like to walk back from that one. So Nicholas, thoughts, recommendations on that?
So it's if you're going to use your worst case scenario of you somehow manage to get everybody in the school in against all the current protocols and do a gymnasium and sit in circles for an hour singing songs, that school in that kind of situation, depending upon the exposure, the outcome may be that classroom, that grade level needs to be home for 14 days. It's really, the intention behind it is to be very targeted, to be as least disruptive, but as safe as possible. So it's not like you have a cluster in a classroom, you shut the district down. If you have a cluster in the classroom and all the protocols are being followed and people are doing the way the plans are written, it's likely just going to impact that classroom. And so you should not have events that result in a massive exposure. It's the threshold they're looking at is, a substantial exposure is going to be about 50 people. And in that case, the state would provide additional support and do some testing to help get a handle on what happened and who may be getting ill or exposed and test positive for COVID in a situation like that.
So our protocols are designed from the bottom up to limit the radius of exposure. And because of that, by definition, that would isolate how the worst case scenario of how many people may have to be quarantined and sent home for, say, 2 weeks. Okay, good. I think that's going to be very reassuring for members of the community. Okay, thank you.
Thank you, Owen. Janie, did you have a question?
Yeah, I do. I just want to go back to something about the testing and the turnaround. So it's kind of multi-layered. Say a teacher goes in for a test, and then you said the information gets put into the database for the state. What do you expect that turnaround time to be from when the test result comes in to when we actually would be acting upon that? Is that another, say the test result comes in at 3:00 on a Tuesday, do we know by Wednesday morning that teacher won't be back in the classroom? Say they had a positive test, say they were asymptomatic, they took a test. Will we know that quickly for them to not return to the classroom the following morning? Just knowing that there's some bureaucracy that we unfortunately we have to deal with when it comes to this stuff. So that's one question. The other part of it is if we have a student that goes home sick, say they had a sore throat, they go to the nurse, they go get a test, and then they get their result, and the parent calls us and says, my child has a positive result. Can we act upon the parent letting us know that, or do we have to wait for that result to come through the state database?
So most of the time when somebody gets a positive test result, they're going to find out about it. The state, it'll go into the database at approximately the same time. But that individual will likely get a phone call or a text message that, hey, your test result was positive, or an electronic message through their health system. There's going to be follow-up to that message, but that message will likely result in that individual notifying their employer, hey, I got a positive test result. When that happens, the district then would reach out to the regional support structure, which would be, we'd be in that. We'd be able to go into the system, say, yep, it's here, and work on that contact investigation and assist the district on, okay, who was exposed to this individual in the previous 48 hours. Those individuals that had close contact in that time frame are people that we'd want to see not present, and work through that process. As far as the turnaround time on the test, it depends upon where the test is being done and who's doing it. And so Minnesota has phenomenal capacity for the tests that are done here in Minnesota, whether they're at the Mayo Clinic or the U of M lab. But some clinics and other systems are sending them out to the national testing groups. So if you're going to some clinics, they may mail it out to a central repository in the entire country, and it gets put in a queue. And so tests done here in Minnesota, we're seeing they're getting done relatively fast. Tests that go into some of those national systems are taking sometimes several days.
Okay.
And so if somebody goes home symptomatic, they're going to be told not to come back until they have no symptoms. That's the exclusion process.
The other piece that if we have a student or a staff, this primarily I'm speaking about a student, if they have symptoms that relate to some other what we call just a routine childhood illness, we're still expecting them to stay home 24 hours based on the child care guidance that we follow from Hennepin County and other and all the epidemiology standards. So though we still have to go by those things. If it's strep throat, maybe they've got a stomach ache, the influenza-like illness symptoms, things like that. So those are still also a baseline for the practice that we're making decisions on.
Okay. Thank you.
Anything else? Thank you, Janie. Lenny?
Quick question. You had mentioned the parameters of 6 feet and 15 minutes. Do we have any data on the risks associated with over 6 feet, but exposure of 4 to 6 hours?
It becomes a continuum, and so there is limited data, but it's not the standard that we're using. That the CDC and the state have set are 6 feet 15 minutes.
So from your perspective, really the social distancing is, and I don't want to put words in your mouth, but that's the critical piece. So from a district perspective, that to me seems like a critical thing that we have to commit to, is that distancing part. And that, like you said, there are other layers that we're putting into the system, but from what I'm hearing from your expert opinion is that the most important piece is that 6 feet of distance between people.
And you'll hear later on, Erica, you're absolutely right. You'll hear later on as we start thinking about how to add students into our model, it gets problematic because we lose the ability to social distance the more students we add into the system.
Right. Okay. I just wanted to make sure that
you're absolutely right. Yep.
Okay. Ellen, did you have more questions?
Just a quick one. Who's going to be paying for the Edina tests and contact tracing?
The contact tracing, the work we do is part of our routine public health work that we do to provide for the city of Edina. If there is a exposure event that rises to that threshold of 50, the state would be assisting on the testing.
But until then, even for our teachers, is it out of pocket?
The saliva tests are the state's providing those for free at a certain quantity, and then the state has negotiated for most providers. COVID tests are no charge, and there's going to continue to be community testing events occurring all over the metro and the state this fall and winter. So there will be multiple ways that individuals can get tested if they need to get tested or have some symptoms that are either no barrier or low cost through their health system or through some of the state or other community-based events that are occurring.
Okay. Thank you.
Are there any other questions for Mr. Kelly while he's here? Well, I just want to extend my gratitude to you. You're obviously going to be invaluable to our district and the partnership we have with you in keeping our students and staff safe. So I really appreciate it. And I appreciate your time here and answering all these questions.
Thank you.
Yeah.
Thanks, Nick.
Yeah,
Thank you.
Thank you, Nick.
It's a pleasure to work with you.
Okay.
Thank you.
Okay, I'm going to run through to talk a little bit about buildings and food. So I'm going to have Eric and maybe Mary Hyman just talk a bit about how our buildings are being to this pandemic and to the protection of our staff and our students. So I think I'll start with Eric and Mary, and then we'll go to Dan for food, and then Troy. We'll go to Troy next with athletics. So, Eric.
Hi, everybody. John asked me to talk a little bit about what we're doing with our buildings and as far as prepping for school and then during school. We created a checklist with the help of our mechanical engineer at Wold to look at mechanical systems as far as steps to take at each site. And so we're looking at filtration, we're looking at run times, we're looking at outside air, we're looking at days of operation. We're looking at modifying the systems themselves. Right now, all the new systems are controlled by minimum outside air as required by the state and CO2 measurements based on how many kids are actually in the classroom. We're going to modify those and eliminate the CO2 portion so it doesn't restrict it down. We're going to set our minimums and then we'll adjust it based on outside air temperature. And so we can get the most outside air as possible coming into our buildings. We do plan on running those, our mechanical systems, at least 6 days a week. So we get the full flush on a Wednesday and on a Saturday. We're going to run the mechanical systems at least, we're reviewing how long they're going to run, but at least 2 hours before and 2 hours after staff come into the building so that the buildings are starting fresh every day. We're looking at the filtration system on each one, on each air handling unit to maximize the quality of the filter. And we're going to start out with new filters on every air handler unit. We're looking at working with the isolation room to create a negative space so that, or negative air, so we don't allow that air in as much as possible, allow that air to be transferred into another space. Cleaning, we're going to do, obviously Wednesdays are going to be extra cleaning days for the touch surfaces. And we'll obviously do cleaning as we have in the past in all the classrooms. We'll do additional cleaning during the day on those high touch areas, whether it's doorknobs or handrails and those type of areas. We're working with our chemical supplier to make sure we're really clear with Mary and her team on the chemicals that we're using in our district and which ones we're going to have in the classroom that are safe for teachers and students, and which ones are going to be used by health and custodial that have been trained to use it. We're setting up specific cleaning protocols so that, and we've been able to practice them for the summer programs that we've had, making it really clear what the custodians are touching and which make it so that we're really coordinating with the teachers within that space so they understand what we're touching compared to what they should be touching. And I think that worked well in the 3 summer programs that we've kind of gone through. We still have to work a little bit through the lunch scenario, but I think we're pretty comfortable with the one modification that we're making is we're not going to break down organics. So in an elementary classroom, they're going to get a lunch in a bag of some type, or they'll have a paper towel as their placemat, eat their lunch, pick everything up, and everything goes in the trash. We're not going to do the separations. And that trash is actually going to be out in the hallway, so we can take it all out in the hall and get it out of the classroom immediately. I think those are the top ones. I don't know if Mary has any other thoughts.
I'm actually looking at the family dashboard that Mary Whitey has done, and under facilities, they did add hand dispensers in all of the vestibules of each of the main buildings or the main entrances at the buildings. So that's primarily for once we get visitors and families back in. Students will be expected to use the soap and water at the bathrooms before they go into their classrooms. Once they get to their little pod area, we're going to be doing markers on the floor for social distancing. But the other thing that we're trying to still kind of go through this from a health services standpoint, if a student needs a medication or some sort of first aid, we're going to do some extra training so that the teachers will, get some reassurance on the first aid that they provide in the classroom. But also, I think we will go to the classroom to administer medications. So we won't have the, 75 visits at the high school, back every day. There's significant numbers in some of the different schools. So we're going to bring the services to them. So those are some of the things that we're looking at. But otherwise, I think Eric really hit the topic pretty well. From a COVID self-screening, we've come up with a printable PDF that go over the symptoms that we want students and families to review every day. And we'll have a slightly different system for visitors and volunteers once we're at that point, coming into the buildings every day. But we will not, a lot of people have been asking if we're going to be doing temperature checks at the buildings. The answer to that is no. That should be part of the COVID self-screening at home, but that doesn't mean that if there's someone that might have some symptoms at school, we'll still do that process at the buildings. That piece is still there. But it would just create too many complications if you've got a whole bus of students coming into the front of a building, or even if we staggered the students and they're coming in different doors. We need to have a consistent, sustainable process across all of the buildings. And so taking the temperatures is just not sustainable and consistent. And especially when the weather starts to get cold, we don't want a backup of students. So there's a number of reasons. And then from what I've read, temperature or fever is just one symptom. There are many other aspects of that rather than just one number of a fever. So that's that was the rationale behind that protocol.
Thanks, Mary. Why don't we jump to food service? Dan?
Yes, sir. Good evening, folks. Let me make a broad swipe of where we're at. starting with the elementary schools, just looking at the, and each school is different, and I plan on reaching out to the principals starting tomorrow to schedule some time to talk about what we do in each building, because it does vary based on the different things that we've done there over the years. But basically, the breakfast program has all been in a bag already. It's a cold program that some kids come in and grab it from a cart right near the door and go to their classroom. Some have gone to the cafeteria and picked it up. But we don't see that changing much. All the product is all prepackaged. So we see that staying pretty much the same. From the lunch standpoint, as much as we'd like to serve hot food, and we know kids eat more hot food than cold, we'll have to evolve to that once we work out some kinks, the next few weeks. So we'll start with the cold bags. The elementary schools expressed a desire for us to deliver the bags to the rooms. So with Infinite Campus's help, there are a couple pieces of software that Steve and I have looked at that we think would be very beneficial to us. One is if the teachers, when they take attendance, they can certainly ask students if they're going to partake in the lunch today, and we can get numbers of how many classrooms need lunch bags and milk to the managers, so we know how many to prep and how many to deliver, if we can get buy-in on that. And also on the back end, so that from a safety standpoint, to not have to worry about claiming the meals as we deliver them. Then again, the teacher or a parent or somebody adult in the room can pull up. There's a program called Class Serve that, depending on who has a bag in front of them, they can just click the student's account and it can debit their account. So it would take a lot of time out of certainly my managers have to doing it manually. I will add a little caveat that we're finding Chartwell's is our company, and you may know through the politics of things that there is some talk that they're going to continue the summer school program, and if they do that and don't go back to the national school lunch, then everybody will continue to get a meal if they're under 18, and so that would streamline things incredibly well. From a claiming standpoint, the other could be cumbersome based on if we have to look at the eligibility and ding students' accounts. So that's sort of it in a nutshell. There, I'm planning on reaching out to principals and to start schedule some time next week to drill down further on their particular schools. I've had some talks, spent some time with Tammy Jo over at Southview the other day regarding how Southview would look. Need to speak some more with Sean. Spoke with Andy at the high school, his team today, have a better idea of what those look like. But basically, breakfast can still stay the same in those schools, similar pickup and either eat in the cafeteria. Southview does go to their classrooms, and that has worked well. But lunches, the students would come down by class, come through the servery to just a couple points through social spacing to pick up a bag, choose their milk. The cashiers would have a radar gun that could, just click the barcode on their badge. So we're looking to implement that students need IDs to eat every day, and so that way nobody's touching pin pads. They just walk up, make sure everything's in the bag, so all they have to do is just click the gun to read the barcode. Along with that, so that there is no change of money and having to deal with students passing over money or cashiers having to deal with money, we've look to go to a cashless checkout. So we are starting to communicate to the district that families will need to put money on accounts. I did correct sent something to Mary tonight or earlier this afternoon about we can still take money at the offices, or the front office, or checks. My managers can put them in during the school year, so it's not like everybody has to go on the portal. At least I think people don't have to go on the portal and get the charge to put money on their account. It can still be brought to the school, and we can still have it. We're just trying to eliminate. It would slow down the process for starters. Plus, it would eliminate any of the touching of money and passing it back and forth and so forth. So we're looking to implement that this year. A lot of school districts around the area have been not using cash for some time. But that's sort of it in a nutshell. I do have one other thing about, or two issues that we'll have to work through. And one, the USDA commodities that we buy, the money that the district gets that I purchase, the government at this point, and it's controlled by the state. All states manage the USDA program, but we're told that the commodities are still coming. So everything that I've ordered this past spring that will start showing up here in September, quite a bit of it is frozen goods. The canned goods I buy tend to be, just canned fruit. Canned vegetables aren't that good. So I buy fresh frozen vegetables, but the meats and the cheeses are all freezer oriented. And of course, as you can imagine, the typical process is the products come in, we menu the products that we're using, and we cook them and send them out. So, and I've let all the buildings know, but as soon as we can get to doing some hot food based on whatever happens the next month or two, sooner the better, even on a small scale, because it looks like we'd probably be needing to store, whether in a contract storage unit or a reefer, a refrigerated truck that sits somewhere. But it looks like if we stay cold for any period of time, certainly into next year, I'll be running out of space to put things. And then some are aware of the whole distant learning part of the piece of this, and the state does require, if kids are home learning, they're still allowed to participate in the food program. So again, if it's something like this summer where it's a matter of just delivering it to them or having them come pick it up, say when they're picking up their student at the end of the school day, it'll be easy to pass them out. If it's a matter of going back to the National School Lunch Program, then there's a process of claiming, but we still have that.
Dan, you muted yourself somehow.
I'm sorry. Where how far back where did I leave off? Maybe
you were just talking about the
two sentences.
Yeah, not that far.
Okay. The distant learning piece.
Yeah. There you go.
Yeah, and so distant learning, we need to get children meals, and so part of the idea is if we stay with the 212 on Tuesday afternoon, if a parent comes to pick up their child and they want to partake, we could give them breakfast and lunch for Wednesday, Thursday, Friday. And then again on Friday, for those families, they would get meals technically for Monday, Tuesday, Wednesday when they're home studying. But, how do we do that and manage it? Does each school have a Google Doc that they sign up for? Or, it's something that is a pretty big nut to crack.
Okay, Dan. Troy, real quickly, you want to run through what's happening in athletics, and then we'll stop for questions, and then we'll move on to our programs.
Yeah, good evening, everybody, and Board Chair Allenberg and Superintendent Schultz. Thanks for having me. This is Troy Stein, Assistant Principal, Activities and Athletics Director at the high school, and I'm here to give a few quick announcements related to athletics and activities. On Tuesday, the high school league, the Minnesota State High School League, made a decision to push football and volleyball to the spring and create what we're calling a fourth season, which would be between the winter and spring, then pushing back a little bit into summer. And those specific details remain to be determined. They also reduce the remaining fall sports in the number of weeks to 20% and reduce competitions in 30%. And the concept around that was to try and mitigate the transmission of any potential virus to other communities, limit travel, focus on local travel. So local travel being defined as conference and or section opponents specifically. We will continue to work with the high school league, MDH, MDE. Mary Hyman has been remarkable with working with us in terms of establishing protocols for the safe return of fall athletics specifically. And we are just starting the process to look at what it's going to look like for our clubs. If we have them, activities. For example, we are working with speech and debate for a virtual experience this year. And they are well along the way to providing that. So we are working with transportation. There's some complexities with limitations on how many students we can get on a bus. So work with HR and we have a transportation waiver that we're going to use that can help families and the district get to away local events if we need. We do plan to provide transportation to every event. So we're going to ask if we can't get everybody on a bus due to the requirements, that we would ask families that are able to drive to the event to do that. And then we would provide to anybody that can't. A big change from the high school league was that due to COVID and the fact that the high school league budget is really generated from 80% of state tournament revenue, and the loss of the boys basketball state tournament from winter, and the more than likely the loss of state tournament revenue from fall, the high school league did reformat their fees to member schools, which would be more of a membership fee concept. And so our fees at Edina will go up. They went up this past year, and they will continue to rise. And I'm guessing that we're going to be around $20,000 in fees this year to the Minnesota State High School League, which is going to be more than double than what we have done. So again, this is somewhat COVID related, but also an ongoing issue as state tournament attendance has continued to decline in that area. So that's my quick update, and I'll turn it over for any questions.
Questions for those three areas: buildings and food and athletics.
Janie?
I have a question right off the bat. If Troy, could you call out specifically what the activities and what the sports are that will run this fall?
Yeah, so we will have cross country, both boys and girls. And again, these will start on the normal fall start date of August 17th. We're going to have soccer, boys and girls, girls swim and dive, and then girls tennis. All adaptive sports are still to be determined as they work with the Adaptive Association over the potential safe return in that area.
Okay, theater, will that still go on?
We are looking at all of the fine arts and activities and co-curriculars as they come up. We were just talking today in our admin team around, what are the possibilities to do that in a safe way. We know that we're not going to be having an audience, and in fact, when you look at sports, for example, we are not allowed to bring spectators into our schools. So we're working with a streaming group right now to be able to stream those events. And similar to a theater production, we would look at that possibility. Our hope is to certainly do that if we can.
And do I understand that a certain amount of spectators can go to football games and soccer games, you're going to have some way of handling that. Can no attendance at swimming meets, I understand. Can there be attendance at cross-country meets?
Yeah, so specifically the venue dictates your attendance. So for example, at Coleman Stadium outside, we can have 25% of the capacity up to 250. So we will certainly work with the high school league and the Lake Conference over providing some guidance in terms of how we can equitably allow spectators in. I'm guessing a focus would be on parents, and then we go from there. The cross country meet, they've said with open campuses, then you're related to the square foot of that area. So we'd have a lot of flexibility with a cross country meet.
Okay, thank you, Troy.
Yeah.
Yeah, I had a question. I don't know if this is directed at Eric or not, but will classrooms be set up with kind of predetermined spaces for desks and tables to keep kids socially distanced? Will that be done kind of on a higher level so there's consistency, or is that something that teachers will have autonomy with to design their learning spaces within the guidelines that are given?
Yeah, working with the principals, it seems more realistic that it is at the teacher principal level. Obviously, we're there to support, but each room is so unique to itself. Not only just the size of the room, but it might have cabinets, it might not. The furniture could be different. So leaving it up to the people that are going to be working within the space, and then knowing the number of kids that are actually going to be there will dictate that.
Okay, thank you.
Mm-hmm.
So, Eric, I have got a couple questions on ventilation systems.
Okay.
And I'm just wondering if the state has any standards in airflow in classrooms, or is that left to the districts?
No. So our building, as we're doing mechanical upgrades, we're bringing them to code, and code is 15 cubic feet per minute per person. And so we'll be meeting, all of our buildings meet that code, and it's not based on anything but that
Okay.
That number.
And that's really good to hear. I know that the district's been working hard at upgrading the HVAC systems. And then I'm wondering, I've been just doing my own research on this, and University of Minnesota just came out with a research brief on how coronavirus travels indoors, and it has some recommendations on where a teacher should stand in front of the ventilation system. I was wondering if you were aware of that.
I did briefly see it. I don't know that I read the entire thing, but I had a conversation with our mechanical engineer just this afternoon. Yes.
Super. So that's the type of information that where the teacher stands makes a big difference. And I would recommend that those types of guidelines be incorporated in our school. We consider laying the room setup.
Right. Keep in mind that test with at the university was in a highly controlled environment, and they knew exactly where the damper positions on the louvers were. They knew exactly how much air was going through. They knew exactly where it was going. And again, each one of our classrooms could be different. And so to say exactly where for somebody to stand for the perfect model, we would have to have all those criteria under control.
Got it. And can you talk to me a little bit about what super cleaning or whatever's going on Wednesday or Tuesday night or
sure.
whenever it's happening?
Sure. So Wednesday is, I'm just calling it a rest day. So if the building we're still going to have people in the building. It's still going to be, I'm assuming teachers are going to be there. I'm assuming there's going to be some people in there, but the load of the building is going to be dramatically less. And so we're going to run the air handler as it's a full building. So we're bringing in fresh air, and that's a really key component. The buildings should be clean because they're clean Tuesday night as far as getting the trash, cleaning the bathrooms, doing all those all the big areas. And so we'll have more time to go in and clean those touch areas in classrooms. And so we'll be working through protocol with our custodians to hit specific areas, and we'll list those out for the teachers so that we're all on, or the principals, so that we're all kind of on that same page. But it's our opportunity to do additional cleaning on top of the cleaning that we did the night before.
And is that same cleaning going to be done then on Saturday or Sunday before the alternate?
So there's a couple things that are happening. First of all, we have an extra day in there. So we have an extra day of downtime. We're going to do as much cleaning as we can on a Friday. And we also have a building check on a Saturday and Sunday. And so they'll be assigned tasks to come in and do specific touch surfaces. Again, this is a team effort, and this is a layered approach, as Mary said. There's multiple layers of what we're doing. And, you know, it's interesting because more and more research that I hear, and if I get a chance, I'll have to ask the epidemiologist what his thoughts are on, but it's that the touch surfaces are not as critical as it was 3 or 4 months ago. So I'm going to have to get his input on that.
Yeah. No, that's what I understand too. Thank you so much, Eric.
You bet. Thanks for the question. Yes.
Eric, I just had a quick question related to the ventilation. I know you said that the buildings themselves pass all the ventilation. Does that mean, do all portions of the buildings ventilate as well as others? And I'm basically only speaking of the basement of the high school and those rooms down there that don't have any windows and things like that.
Sure. So I did get this question from the union representative. He was going to get back to me about specific rooms that they had questions on. But yes, the ventilation does feed into all the areas. When a ventilation system is designed, it's designed with the CFM requirement, and it's also designed with doors closed, and if it has operable windows, with windows closed. So it doesn't matter where you are within any building, it's designed with the classroom door closed and any exterior window if it has it closed. So it kind of replicates that same environment everywhere.
Okay, thank you.
You bet.
Julie, do you have questions?
I do. I just have one. You answered a lot of the ones that I had, but I just have one question. You were talked about how you are going to flush the ventilation system 6 days a week. You said 2 hours before and 2 hours at the end of the day, correct, Eric? Or something like that?
Yeah, 2 hours before and 2 hours at the end at a minimum.
Okay.
For the 5 days a week. And that's something that we're going to, again, get a mechanical engineer to give us his opinion on, but that's kind of where our starting point thinking is.
Okay. And have we, I guess I'm just curious about the change. Have we ever done that before as a district, or this is new?
So, you know, my philosophy has always been control costs, right? Mm-hmm. And so I don't start until I have to. It's called an optimal start. We know when kids are coming in, and we can put it in the computer, and it does an optimal start. It doesn't, if it's warm outside, we're not going to start it right away. If it's cold outside, we'll start it a little bit earlier. And at the end of the day, sometimes we'll shut things down right when the kids are going to exit the building, because we know there's plenty of fresh air in the building for the last teachers to kind of hang out, and the load of the building is dramatically less. But we're not going to be looking at it from an energy standpoint this school year. I've talked to everybody about it. That's not going to be a factor. We're doing it for complete operation of get as much fresh air in the building as possible.
Excellent. Okay, great. I just wanted to point out that there's a big shift in what we're doing. So.
Yeah, no, it'll be dramatic, and we'll see it on our electric bills.
All right. Thank you so much for your work.
You bet.
Eric, I've got a question for you. We, in the hybrid model, need to be at 50% capacity. And you may have said this a few minutes ago, but I either missed it or I misunderstood it. When we talk about the definition of capacity for a room, are we talking about the class limits as specified in our class size guidelines, or are we talking about fire code? Because those are different numbers. Would you happen to have an answer for that?
Owen, we'll get to that when we start talking about the buildings and the classrooms. So can you wait and hold that, because we got an explanation, because we got that, kind of an instructional application to that.
Okay, sounds great.
All right, thanks, Owen. Other questions? Okay.
Sorry, my mic.
What, can we go on, Erica? I'm sorry.
I think so, yeah. I wanted to thank Eric and Dan and Troy and Mary for being here and all your work that you're doing for this. I appreciate it.
Okay. Let's jump to childcare real quickly. And staff and administrators, the board has read the report, so don't need to repeat the report, but just hit the highlights when you're doing your presentations. This is meant to really allow them to ask questions for their constituents. So let's start with Rachel and Val regarding childcare. So Rachel, you just want to talk a little bit about what the plans are moving forward? I know we still have some plans to do around childcare, and so I'll turn it over to you. You're muted, Rachel.
Good call. My name is Rachel Hicks, and I'm the Youth Programs Coordinator for Edina Community Education. And we've been working closely with the district to look at what the district is offering as far as models, and then how we can work around it. And how we can work with it. So what we are looking at for this fall currently is looking at offering after school care for all of the elementary schools 4 days a week. So it will be on the Monday, Tuesday, and on the Thursday, Friday. That is currently where we have landed. And we will continue to assess and reassess the needs and the space available to us in order to look at additional options regarding care. Val, is there anything else you wanted to add?
No, I think you covered it beautifully.
Can I jump in with a question, Erica?
Absolutely.
So
I wasn't sure if that was speak or not, so I just wanted to.
Sorry, Jeannie.
No, that's okay. So just from a thinking standpoint for parents who may be questioning, if my child, say I have an elementary child that goes to school Monday, Tuesday, or have we looked at whether or not they would be eligible for any childcare on the even if it was just the afternoons of Tuesday, Thursday? And also, what is kind of the thinking behind, I think I'm going to know the answer, but I just want to make sure, not offering any care on Wednesdays?
Good question. So one of the things I'm looking closely at in regards to offering care on Thursdays and Fridays for A kiddos and vice versa for B kiddos is the ability to keep them separated into pods. One of the things we learned this summer in programming is the positive results of having kids closely connected to pods and traveling with those pods and being able to contain them, and looking at that is something we'll absolutely look at going into the fall, if that's something we can offer to families. However, it'll be very closely looked at according to safety protocol and what we can put in place in regards to staffing and student separation or into pods. In regards to Wednesdays, we have looked very closely at what our buildings space has been and what our capability is. We're also pretty concerned about the cross contamination or cross. That sounds bad, but the crossover of kiddos, the A's and B's on Wednesdays. And so that is something we're looking closely at as well. What we decided is we know that we can sufficiently and excellently provide care for after school for kiddos when they come on A days and for kiddos when they come on B days. So that's where we'll start.
Just to add a real quick thing to that is Rachel and her team did an amazing job this summer of kind of phasing in, sort of starting out with a reasonable amount. Our philosophy was under promise, over deliver. And I believe they did that. And so I think we will take that same approach this fall as we're all sort of learning from the delivery systems we're offering, how we can phase in additional care and additional options for families. Because I think space will follow. It's just initially we all have a lot of learning to do. So we are prepared to step into that as it evolves. And so, again, I really would applaud the team this summer for taking that approach, because as you learn, you really are able to perfect the processes. And I know there's been a lot of cross-learning amongst us about how they did their work this summer.
Thank you. Ellen?
Yeah, and I just want to just double check that you are not talking about childcare for first responders, right? So
we are not.
So is that, and childcare for first responders will be totally separate? You know, you're talking about your concern about A and B day kids getting out of their bubbles. I'm just wondering, I'm just making sure that we that this is what the plan is to make sure that we are maintaining the A bubble, the B bubble, and then the first responder bubble. Is that what I'm hearing?
Right now, we're working with the district on perfecting that plan. But absolutely, will we be covering our first responders and our tier 1 workers? I think we're gathering data right now on how many there are, who they are. I'm not who, but I mean how many really, and where they fall in terms of what school, et cetera, so we can plan space accordingly. But our building principals have reserved spaces in each building to try to help us determine that based on spring numbers. So I wish I had a absolute answer for you, but our programs sort of surround the instructional plan. I mean, they don't sort of, they do. And so we're just waiting for that to absolutely be in place, so then we can determine with our colleagues how to continue to maintain the groups. I mean, everyone, that's front of mind for everyone. It's just no one's going to tell you differently. It is complex. And I think as you talk to the building principals from the elementary, you're going to see that. And so fabulous team to be working with in terms of problem solving, but I don't have exactly how that will be in terms of the spaces they'll be today. Julie.
So, Val, I read in here that we're planning for up to 100 families at each elementary school. And can you tell me what that means from a space perspective as far as classrooms that's going to require at each elementary school?
The beauty of the AABB days is that really once school ends, we have access to spaces. So we have access to more spaces. And so we're very fortunate. Josh Jansen, who's one of our new deans, is our liaison with our building principals in terms of how do we determine once we see how many are actually in each building that need after school care, what spaces, and how, our communication plan with the teachers that we'll use, because we do know that we will need classroom spaces. It's not, our traditional program is based on large spaces and open areas where we can intermingle kids on a regular basis. We know from this summer, and we know from the disease, or the virus. That isn't the case. So, and our principals know that. So we will be working closely with buildings and grounds and with our principals and Josh to determine like what the spaces we need for the amount of students that are in there. And we base that 100 just sort of on the limited data we have right now from parents that are telling us they need childcare.
Can you give me an estimate? Because I know that this directly impacts the number of students we can bring in for K-5. Is this space swap? So I just didn't know if you were talking about 3 classrooms, 4 classrooms.
No, I mean, if we serve 100 students, we're planning on a 1-to-15 ratio. So we'll need 8 classrooms. We'll after school though, again, once the school day is completed. And so we're pretty good at the transition time and how we're going to lay that out. And then our kiddos will go to, in a perfect world, they would be in a classroom in the day, and that classroom would move to the same pod after school. That's the perfect world. And we're just continuing on with those discussions of how close to that, or could we reach that, or how would that really look?
Okay, thank you.
So until we actually get bodies signed up and get people placed in classes, I really am not trying to sound vague, and neither is Rachel.
I know.
That will be really what tells us how we have classrooms allocated after school. What I do know is we understand clearly that we have working families that need this, and we're going to do everything we can to make sure that they can be served.
Okay, thank you, Val.
Mm-hmm.
Are there any, Julie?
Yeah, I apologize. My family doesn't know where I am, so they keep calling me to find me. So I have just a quick question. You guys, you didn't mention anything about morning care. Is that off the table? I just wanted to make sure that I understood that. I assume that, but thought I would just ask.
No, that's a good question, Julie. We've talked about that quite a bit, and it's still on the table as a possibility for Normandale because their school starts later. I haven't received full confirmation as to what time students will be arriving based on the busing. Transportation is obviously something that's been talked about pretty frequently. And looking at the amount of time.
Rachel,
oh my gosh, I was almost done. I'm sorry.
Rachel, that happens to me in lead team meetings all the time. People mute my mic.
Oh my gosh, I'm so sorry.
The last sentence we didn't catch.
Oh, really?
Mm-hmm.
Okay. So we've looked at, great, now I'm not gonna be able to grab. We've looked at the amount of students we normally serve and the amount of time that we are serving families in the morning, and the risk factor involved with adding students to another cohort, another group during that time, just outweighs the risk outweighs the benefits at that point. And therefore we feel as though we can do after school really well and safely. We don't feel that way going into mornings right off the bat.
Got it. Thank you.
Ellen?
So, and I'm just trying to figure out how this is going to work. It's after school ends, then the rooms are all going to be cleaned. The classrooms are all going to be cleaned, and then childcare is going to start. Is that how that's going to work?
We're working with Eric on and the buildings and grounds, but it's the same set of kids, Ellen. So if we move them from their pod and we keep them potentially in their classroom, the cleaning requirements for that are really
right.
They're not changing.
Right. That wouldn't make it. But when I think about 15 in to 1, which is the ratio we're saying, that would be the whole class staying.
Yeah.
Clearly. So I'm guessing is there's going to be some moving around.
Yes, and I think it's going to be like the staged beginning. And again, we're kind of waiting for the classroom assignments to determine what is the staggered starts. How do we get to our classroom? In that sort of waiting period will be cleaning protocols that our staff or alongside our custodians will be doing if it's a mixture of students, which it very well might be. You might have 2 first grade classes. We're just, that's the part where we're operating a little bit with not all of our knowledge quite yet until we have all the bodies in the spaces and we can determine that.
Val, can I make a comment or add to it?
Please do.
One good thing, one really positive thing that I think we have going is that my department has a really good working relationship with Val's department and Rachel Hicks. And what we've learned is that when we communicate really well, in other words, they tell us what space they're going to be in, they tell us what time they're going to start, and Rachel's crew knows what they have to clean and what we have to clean, we can accomplish that if we've got a window of time. And so once we know the parameters, I don't see that as a hiccup on our side at all. And just like this summer, Rachel made a really clear sheet, exactly what their staff is going to do, exactly what my staff was going to do. And we worked that plan. We modified it as we went. When we went into the next section, we modified it again. And it's all about communication. So I appreciate the question. I don't see that as a hiccup at all in my world.
Great. Thank you.
Thank you.
Thanks, Eric.
I would echo everything that Eric just said. That is one area that I feel very little stress about. I feel like we can really manage that successfully.
Are there any other questions for childcare planning? Well, thank you, Val and Rachel. I know it's a planning on the go, but you guys have done a great job over the summer. So thank you for building on that and all the work you've done. We all appreciate it.
Thanks.
Okay, I'm going to jump to elementary, then we'll do early childhood because we have some just managing individuals' schedules here. So elementary, Karen and Randy and
Katie.
Chris.
Yes. Good evening, everyone. Karen Bergman, principal at Countryside, Chris Holden, principal at Normandale, and Katie Mahoney, principal at Highlands. We're going to kind of tag team and give you a little bit of an overview of some of the projects we're currently working on. I'm going to start with just a few logistics and things that we are doing on the operations side, and then we'll transition to more of the instructional program and some of the details regarding that. So one of the questions that had come up with the child care program details was around the cohort groups of students that we're putting together, our instructional model, as well as our AABB schedule supports that, and we are very cognizant of that idea around making sure that we are keeping kids in those pods, in those cohort groups. A couple of challenges that we are currently working on, and we're getting there, but we have a significant need to be able to meet some very specific needs for some of our students by possibly providing some additional time in our buildings with us beyond what that AABB model does provide. And so we're doing a lot of research and having a lot of conversations around that idea of what does that cohort group look like and how many contacts with the adults do those groups have, as well as how many contacts between kids are we creating during the day. So we are talking more specifically with our health professionals right now just to see how some of the adjustments we're making to the plan to accommodate these extra needs of kids, including our child care component, how those things are impacting or could potentially impact our cohort groups. So that sounds a little I don't know, vague, but I just need for you to know more than anything that we are starting with our basic A groups and B groups, and now we're trying to decide how can we enhance the program and phase in additional support for kids in a variety of ways without exposing the adults or the kids to more individuals than what we feel is safe. So we're working on that. One of the other pieces to the puzzle for us is how do we set all this up very carefully, making sure that we're bringing in kids, families, teachers, and setting everyone up for success as we start this model. So one of the things that you'll hear about tonight is our proposal for how we kind of do that onboarding. What's our orientation plan? When are we bringing in families and kids to orient them and kind of do that open house activity, but also provide a more face-to-face opportunity for kids and families to meet with classroom teachers prior to the start of the school year. We know that there's going to be a lot of questions, and we also know too that the amount of time kids are going to be spending with their teachers will look different. So we want to make sure that we set up that relationship well. So the plans that we are recommending for that onboarding or for that orientation time will help us to set everyone up for a good start. Included in that is a need for us to gather some assessment data from our youngest learners, especially. We are missing some pieces from last spring, believe it or not. And so we've incorporated some plans to gather some student data, just some really key points of information that we think will help our teachers as kids get started and help us do some more specific personalization and instruction. So we'll look forward to getting your feedback on that. One of the other pieces that we are spending a lot of time on is talking about how do we deliver schedules and supervision in a way that supports those cohort groups. So our specialist schedule, of course, supports that, and that's a piece to some of our ideas around supervision. We're also talking about some additional needs that we've identified for possibly paraprofessional support in each grade level or team to make sure that we've got the ability to supervise our kids in, like, say, a recess or a lunchtime, and be able to continue to have our cohort groups stay in their cohort groups and that they are safe and comfortable in that arrangement. So a lot of scheduling kinds of things that we're working on right now related to that. So again, we'll be making some recommendations and requests, and we're working with across teams within our administrative team to talk about how can we partner. For instance, conversation this afternoon, we were talking with teaching and learning, we were talking with special education, we were talking with our childcare folks to see how we could kind of share some of those resources and do so in a way that didn't expend too many more additional dollars to make it all work. But again, our main focus is around how do we make this happen for kids and how do we ensure their safety and the safety of our staff. So I think probably one of the biggest things that we are holding on at this time is we really need to make sure that we are getting the parent information, those decisions about whether they're going to be choosing the virtual model or they're going to be in the hybrid model with us. The other piece that is critical to this is getting our staffing information. So as soon as that is available first part of the week, we actually can start putting some of these pieces together and making some more firm decisions and recommendations. But the childcare conversation really is another piece to how do we serve kids kind of in growing or phasing in other steps within our cohort models. And that staffing information and our parent decisions are really going to drive that. It's going to be based on numbers and how many kids we actually have coming to us each day. So those are just some of the highlights from those operational things that the elementary team is working on. Katie Mahoney is rock star of our elementary world right now because she is leading a think tank around how our instruction is going to be delivered. So I'll hand it over to Katie.
Yeah, thanks, Karen. Appreciate that. Good evening, school board and Superintendent Schultz. And I just wanted to just start by saying that really, as we entered into this instructional framework conversation, Jody and myself and the principals, we started to really look at the feedback from teachers and from parents coming out of distance learning from the spring. And we really started thinking about, okay, where were the strengths? Where do we need to start improving, and how do we move forward with what we've learned? And so we just learned so much from the spring, and there were some real positives, and then there were some real areas for continuous improvement. And we all know in this work that that's our job, is continuous improvement. And I just can't thank our teachers enough for all that hard work that they did in the spring. And it really guided our learning into summer success, as well as what we're going to be doing in the fall. So with that being said, as we start to think about our instructional planning for the fall, we want to ground our teachers back into what they know is best practice, what they know is best for kids and for learning. We know how to teach kids. Our staff is some of the best, I would say, in the nation, and they know what to do. And now it's just we need to fit all of that knowledge into these different formats and these different models to make sure that we're reaching all kids. So we, again, are refocusing on the 4 questions of the PLC. What do we want students to know? How will we know when they know it? What will we do when they don't? And how will we keep pushing them as they do know it? So that's kind of where we're grounding ourselves, as well as in the teaching and learning cycle. So really thinking about what do we want to teach? And then how do we review that as PLC teams, as district teams, and how do we keep continuously improving this work? So things that we can assure that we're going to be back in is K2 is going to be utilizing Seesaw for their communication and their online server. And then 3 through 5 will be utilizing the Schoology. And that's something that all teachers and parents are now familiar with. And so that's something that we can come back to really understanding. Some language that we're trying to shift in elementary to get us back again to like what I'm talking about with comfort and what we know is right and best for kids. Some language we're talking about is live teaching. So where's the live interactive teaching, whether I'm in the 4-wall classroom with my kids or I'm online with kids directly, that's considered live teaching because I'm making those key instructional moves for kids. And I'm talking with kids, I'm engaging kids, and I am teaching students in a live way. And then thinking about a flipped model of instruction for when they are not in front of me, they will be doing flipped lessons that are grade level standards or independent work that continues the lessons from the in-person, and really thinking about how do we provide the support for both of those elements, but really a focus for teachers and for students and for families around live teaching, because coming out of the spring, we know that both teachers and parents, the main feedback was we need more live in-person teaching, and that needs to be a priority coming into the fall. Teachers also know that, and then they want to know how they're going to be supported in that work. So that is really a huge priority for us right now as we start thinking about this instructional hybrid model. And really, what I would love for all teachers and the community to visualize is that every So elementary teachers teach many content areas. They teach language arts, they teach math and science and so forth. So every content area has high level, grade level standards or lessons, strategies, skills that we want all kids, no matter what building they're in, we want them all to be exposed to these lessons and these skills. And then there are all of those moments between the teacher in small groups, in one-on-one, in mini lessons, and all those little small moments that we know is the key component to learning for kids. You need to know where they are at. You need to know what they need to know. And then you really hit hard those holes to keep them moving, keep them progressing in their learning. So as you think about what would be a flipped lesson, the flipped lessons are those large content lessons that we know all kids need to have exposure to, and we want to make sure that we're consistent at all 6 sites. So those lessons, we're talking as a district leadership team about how do we create banks of these lessons that are created by our teaching staff across the sites in a collaborative and really supportive way. And then which really frees up our teachers to focus on the in-person lessons with all of their kids when they have them in front of them, and really think about those key instructional moves that kids need to make sure they're progressing and that teachers know exactly what they need to know. So this is, we started this work, a group of us started this work, teacher leaders from all 6 sites, as well as myself and Jody and Sean Beaverson. And this week we put a screencast together and pushed it out to all the PLC leads at all 6 sites. We've gotten some amazing feedback from the teachers who have been able to process this already, about just feeling like they really understand what are the small what's the continuous improvement? What are we moving on in the into the fall, and how are they going to be supported? They really feel like they're being supported, and it's an exciting conversation that we're in. We, of course, it's like everything, right? I mean, it's the mousetrap game. Once you figure out one little ramp, 5 more fall apart. So we're constantly putting those pieces together to execute a full marble run. And we'll get there. We feel really positive about getting there. And it's just been an exciting time. We're trying to really think about what are the silver linings? Where's the positive moves? What are we going to learn from this experience that's really going to benefit and add value to the Edina public school system? And I really feel like we've had some great collaboration and moves on that so far. So I'm excited to keep working with our teachers and keep making this the best instructional model we can have for kids and parents starting the school year.
Thank you. Are there questions from board members about these topics? Julie.
Yeah, I have one. So it's first of all, I really appreciate all of the work and the collaboration. I think that as you guys are, what you said, it is a mousetrap, and I know how challenging that is. You know, you solve one problem and there's like 17 more waiting right behind the door that you can't even anticipate. So I just wanted to acknowledge all that work. So I have a question about the hybrid model. So it sounds like the way that, like, a student comes to school, let's say Susie comes to school on Monday and Tuesday and has in-person learning, right? Wednesday is independent study, independent on their own. There's no connection with any teacher online or anything, right? But then Thursday, Friday, the flip model, is there any interaction, any synchronous learning at all? Or is it really them pulling from recorded lessons, or are they incorporated at all in the day with the whole class?
So, yes, I
think there's some, I know that, and we've heard a lot of feedback from the community about this too, like really being able to visualize. And I know we don't have all the answers, but if you can explain that a little bit more, I think it would be helpful.
Yeah, absolutely, Julie. I think we're really trying to think about the ways we can open up the classroom for kids who are remote and kids who are at home, and whether that's a community time in the morning, that's a morning meeting, or community building time every day for people who are at home or in the classroom. That could be something that everybody could rely on. That would be every day at 8 o'clock. So I think that's one area that we're really trying to open up and see if how we could stream that. The other is just how could we do other streaming for kids who are home in a way that could launch the year in a really positive way, right? So tapping into that social emotional, the connections, the relationships, and those pieces, and then focusing on the instructional moves, being really intentional and really focused around what kids need, both at a high level and at a really personal and intentional focused level. So I think teachers feel the teachers that I've met with on my work groups have felt really comfortable with thinking about the social emotional and the community time being open and being synchronous experiences, because that just feels good for all. And yet I think we want to make sure that as we build these experiences, we're able to build upon positive experience. We're not like setting our teachers up to be overwhelmed with, many tech problems and many, we want to build upon success. And so what can we do that's going to be a successful launch for the academics for all kids? And really first know your learner, know where they need to go. And that's going to be those beginning assessments, and then really that in-person time. And then we know that mental health and social emotional, there's a real high need right now. So how do we bring kids together and build that community again? That will be the focus. So yes, there's also talk about, having some specialist time on the days where the students would be at home or remote. And we also have some intervention, and we have some other pieces that we will also have to fit in throughout the week. And so I think there's going to be opportunities for kids to get touches from teachers and from certified staff. We just have to see how the schedules play out and what's going to maximize the experience and the learning for the child, right? And not overpromise and underdeliver, if that makes sense.
Yeah, no, that does. That helps clarify. Thank you.
If I could chime in on one more piece to that. One of our initial challenges and conversations was around how do you create a cycle where kids have contact with their teacher and their class, whether they're with us in person in the building or whether they're remote on their opposite days. From a content standpoint, you could very easily make this look like only half of the content is getting done, because I've got my A group with me on Monday and Tuesday, and I'm going to present my content, and then my B group comes on Thursday and Friday, and I'm going to present the same content. By allowing that peek into the classroom through technology that we're working on, I think that's the game changer for allowing continuity of instruction, so that the teacher's lessons can have a cycle that not only is a 2-day cycle, but is a 4-day cycle. And it brings all of the students along at that same rate, as opposed to having any kind of distraction or halt to that stream of instruction and that stream of support that teachers are going to be able to have through that daily contact, whether kids are sitting with us or kids are peeking in and participating in the classroom or seeing what's going on in the classroom. I think that's an important game changer for us, because that looks very different than it did in the spring. And I think teachers are excited about the fact that there's that continuity with their relationships, as well as with the instruction and standards that we're teaching to.
Excellent. Great. Thanks, Karen, for that.
Owen?
I have two questions. The first is based off of Katie, what you're talking about, what I'm picking up is the aspiration is success leads to success leads to success. So building off of previous successes, is one of the aspirations in that chain of success having classroom streaming so that the students in the classroom would experience something pretty similar to what the students at home are experiencing. Randy had brought something like this up at our meeting last week, and I'm just wondering if that is something that is planned for, desired. Is it unrealistic, do you think? Just interested in your thoughts.
Yes, I think just to be totally honest, I think we will be experimenting with with how this all works synchronously from the classroom and how that can work. And it just feels better for teachers to open that up to community and social emotional to start. And that's not to say that if I'm doing a read aloud, kids can't stay for the read aloud. So there will be some flexibility obviously around that. But, I think where I would like to just, what I would like to say specifically is if I'm teaching in a classroom and I have 12 kids at home who are engaged and I have 12 kids in front of me, how do I truly engage if I'm teaching a specific reading lesson or a content area or a specific group of readers? How do I ever truly engage with any of them in a really personal and intentional way? Because I'm multitasking and managing so many things. And for all of you that have sat in and watched a guided reading lesson or watched a teacher engage with conferring around a reader, it is really intentional and it's really planned out, and they give their whole focus and they have the rest of their class in a workshop model, and they are engaged in all of these different activities, and they have built this protocol and built this structure so that the kids can be successful in independent practice and when they're intentionally teaching. And so again, how do we build that same structure for teachers? Because we know the true moves that a teacher can make are at that guided reading table, or at that group of 5 readers, are really in that conversation in the next small move. Because let's use the example of teaching fractions. In 3rd grade, you might have a standard that all kids need to be exposed to this concept of fractions, right? But you're going to have some mathematicians in the room that are still really working on addition. And you'll have some mathematicians in the room that are way ahead, right? So yes, you're gonna have a lesson that is on fractions, but when you're doing that small group and you're doing those more intentional small lessons, you're able to really move the student in a way that's very different if I have 12 kids at home and 12 kids in front of me all working on fractions, and I have parents calling in because my connection is dead, and then how do I get the tech person to help? And then how do I get this? I mean, that's a lot if I'm really trying to get the teacher to focus on the lesson of math. And so as we move into this thinking, it's not that we're not going to open up the classroom for kids remotely. I think we will, and we'll have teachers that will move faster into that and to try it and to pilot things and to do it more. But what we want to make sure is we have a baseline expectation about what kids and families can expect. And the biggest expectation I think we have in Edina is that we engage and we provide high level instruction around what kids need, and we really focus on that piece. We know our learners, we know the next step, and we make sure kids learn. So that's what I think all elementary folks want to go into this year with really saying and feeling confident in those moves. And coming out of last spring, it felt really awkward and really uncomfortable because we didn't have those touch points. So teachers are really excited to be able to do that again and have those touch points and see kids face to face. And we didn't have really any of those touch points in the spring. So,
Katie, this is Steve Butner. I just want to add, Owen, is that the how or the technology is that we're working with our technology to ensure that the capability is there in those classrooms. What I like what Katie is saying is the why, is we're going to take our direction from the instructional leaders as to set those protocols and those standards so that we make sure that the technological tools are there for our teachers and that we can support our teachers, and that when this gets defined by the instructional best practices.
Oh, and did you have another question?
I do have another question. Thank you, Katie, for that thorough answer, and Steve, really appreciate your input. My second and last question here is, we're talking about assessments, and I am wondering, have we thought about MAP tests, which I understand can be taken at home? It's a known commodity. They're consistent and nationally normed. Thoughts, any one of you?
We actually are partnering with the assessment committee right now. They are meeting. I know that Jody and Donna and others are moving those conversations forward. The distinction that the elementary team is making right now is, what are those pieces of information that we can gather during those orientation or back to school times? And then again, when can the MAP tests be incorporated into it? It's difficult to do them from afar. So what we'd like to do, and what we'll recommend to Donna and team, is that we think about when we can administer those in person once we have kids in the building and they're settled into their routines. We definitely want to collect that data. It's just a matter of when is that right time and what's the process look like, so that we are not putting kids in additional uncomfortable situations, but that we're making it a part of their day in a more typical way. And actually, if you go back and look and see when we did our MAP testing last year in the fall, our testing window opened the 24th of September. So if we keep with a similar timeline, we could probably stay somewhat close to that, knowing that by that time we have kids in the building and that we're into a bit of a groove, and that we would be able to see our students and support them through that testing process.
And there are also a lot of assessments, like the Fountas-Pinnell basic skills assessment that we want to do, fast testing. Like, there's a lot of assessments that we will need to do, as Karen mentioned at the beginning of our update, as we begin the year for all kids. So we really know where all kids are coming in and where they're currently at versus where they were at when they left us last winter. So that will be really important.
And again, just to chime in on the technology, we'll have additional technology that helps support that.
Janie, I know you have a question, and Lenny, I haven't forgotten you either. I just have a list of people that have questions. So, Janie, why don't you go ahead?
Yeah, since I have Karen and Katie and Chris here, I'm wondering what the thought is with our choice programs. Is that going to be really based on numbers? Is that going to be something that if I choose virtual and I'm in a CP family, that there will be a virtual CP family? What's your thinking on it thus far?
So related to CP, Katie and I have talked about that. We know that we can deliver CP in a similar format with class placements and such within the hybrid model. The virtual academy, that's going to be more difficult, especially dependent upon the numbers. If we end up with enough numbers, it will be more of a district-wide focus. And, we can't guarantee that the CP teachers at Highlands or at Countryside would be assigned to those groups. One of the questions I've received a lot over the last few days from parents is, when we're back in school all together again, will my choice of choosing that virtual academy now impact me being back in a CP classroom when my kids return to school? And I know that Katie and I have both talked about making sure that we keep that intact and that our assumption is that kids will come back into the buildings and be part of that CP program again, and stay in those communities. I don't know, Katie, is there anything else that you would mention around that?
No, I mean, I think you answered it well, and the premise around relationships and continuity being a focus of CP. At this time, we recognize the real importance behind all of that. So I know that that's going to weigh heavy on some families and their decisions as they make them. And I just encourage people to think about the health and safety risks first, and know that we love them and care about them, and we'll continue to do the best we can. And again, health and safety has to come first. As for the program of French immersion, we've talked to Chris a lot, and he can chime in too, but French, we are going to try with staffing to have a French program at the Edina Virtual Academy. So that should work out. How it works out and who teaches it, that's still in the works, because we don't know which teachers will be assigned quite yet to the Virtual Academy. But we feel pretty confident that a strong French program will be able to be delivered in the Virtual Academy.
Great.
Did you have any other? Oh, sorry. Go ahead, Chris.
No, I was just going to say, I think we learned a lot during the spring. And so even if we are in a virtual learning situation, we can continue to build on students' language growth this fall if they're at the Virtual Academy, either through streaming, and we're looking at bringing our interns back virtually. So there's some opportunities there that we didn't have in the spring that I think we're going to try and leverage. Staffing will be a challenge, I will be honest with you, because I can't go out and just hire French teachers off of the street. And depending on the numbers that we see signing up for Edina Virtual Academy, we may need to get creative with staffing to provide a French experience. But my commitment to those families is that we provide a French experience in a virtual learning environment.
Great. Thank you all.
Thank you, sir. Lenny?
A couple of questions. One, I think, Karen, you talked about this. So the Monday, Tuesday lesson plans will be the same as the Thursday, Friday lesson plans?
No, actually quite the opposite. What we want to make sure that there is a continuity from Monday through Friday, that kids are moving through those lessons. It's our hope that we're able to structure that in such a way so that we are able to present and work with the entire curriculum instead of just half of it if we were just on a 2-day schedule. So we're working through those logistics. Katie's team will be guiding us on that as we get a little closer to what do those daily logistics look like.
And do we know what a virtual day will look like for those who choose the Virtual Academy?
We're actually in process right now. Katie, maybe you can.
No, I was just going to say exactly that. We're in process, and we're talking about percentages of the live teaching, whether they're in the Virtual Academy or they are in the hybrid model. And we really feel like it will be similar. If it's 40% in the hybrid model, we feel like it will be a similar experience, maybe a little bit less in the Virtual Academy, but we will try to keep the live experience in both to be fairly similar. But I know Randy has been working on some of those percentages, so I don't know if he wants to talk to that at all.
Yeah, thank you, Katie. I would just add that what we plan to deliver will parallel the standards and the curriculum and the experience that kids will get in the hybrid. They're just going to get it virtually, and it'll still be a high quality product. It'll still be a high quality educational experience. Some of our designing of exactly the logistics of how it will work will be dependent upon how many kids we have sign up across the district. We know that as of 4 o'clock today, there were 136 students opted into the Virtual Academy at the elementary level. Well, that's about one section per grade level or so. And so those students, if it remained at that number, those students would need to be pooled across the district and pulled together from all of the schools. So depending upon how many sign up in the end, we still have a lot of work to do on the design. We have some meetings scheduled next week to continue to work on the design of it. And we're working with some consultants at MDE on some best practices around online education design as well.
Did you have another question, Lenny?
Nope, thank you.
Okay. I had a question, and I was wondering if someone could speak to, we've had a lot of questions about why aren't different grade levels going 4 days like kindergarten is, and if someone could speak to some of the complexities around that and the strategy around bringing kindergarten in.
I think Chris Holden should talk about that.
I second that.
I can talk about that. So the challenges around bringing additional students into the building at different grade levels revolve around staffing and space. So as we look to get kindergartners in all day, every day, we may need to increase the spaces that we're occupying in the building to get to that capacity ratio. And then we also need to find staff that can support those students in that learning environment. So imagine if you wanted to add sections at first, second, third, fourth, fifth grade, you'd need to find those spaces and find those staff members to provide that instruction.
Thank you, Chris. Ellen?
Yeah, and I was actually, that is similar to what my question is. And my goal after hearing Katie, and as she rightly said, going live is really important. That aspect of live instruction, and I think everybody gets that intrinsically. And so and because the fact that we know about brain development in younger children, the importance of trying to have as much live instruction and face-to-face instruction in elementary school is really on the top of my mind. And so I want to ask a little bit more about how and if the district did look at other models that would tip the balance of face-to-face time from equal, hybrid, all, for the whole district, to more face time to the younger students, given what we know about contagions and also what we know about brain development.
Yeah, so I'd like to jump in on that, and then maybe some others can follow up if you need to or want to. So we did look at other models and what other school districts are doing, and actually the hybrid model that as we have designed it is probably the most common that we ran into across the metro, but there certainly are some districts that have tried to do some different things. And when you look at those districts, sometimes they're significantly smaller, and so they have a different kind of challenge. Sometimes the transportation might be set up differently, so that's a different kind of challenge as well. We have a lot of walkers inside of Edina, and when you move students to other buildings, that creates a different kind of transportation challenge. Some districts might have a different set of resources and funds for how they could staff it. As Chris mentioned, you could reasonably say, well, let's just take K3 and let's put them in the middle schools and let's put them in the high school. And when you're doing that, you're also creating extra sections because you have spread those students out across the district. So you still need teachers. So you would still need to hire additional staff to make that model work. And then the trade-off is your older students would have less face-to-face time and more online time in doing that model. But we did discuss various models and various ways of doing this. And Edina is a unique place. Edina has a set of characteristics on how we develop a school system and how we get the school system to function, including the size of the district, the size of our buildings, our staffing, the number of students, etc. And so what we landed on is a model that we thought was a place to begin. And then as we begin implementing this model and bringing K in, we'll be able to learn from how we brought K in and look at our resources and see if there are other ways to bring in additional students in the hybrid model, in the face-to-face with our capacity. Part of our challenge is also knowing how many of the families really don't want their children at school with the potential to be exposed to a virus and would opt for remote schooling. If that's a very large percentage, then that actually solves some of these issues around space as well. So it is a very challenging puzzle to solve, but we have definitely looked at models across the metro. We've been on the phone. We've looked at resources. We've looked at websites. We've talked to superintendents and assistant superintendents across the metro through calls with John, etc. And we're in conversation with other districts on a daily basis still. Okay. So,
Randy, while you're explaining that, would you address Owen's question about the 50% capacity? You kind of touched on it a little bit.
Sure,
but,
sure. So one of the things we did early on is we wanted to better understand this occupancy description of 50% occupancy, because you could on the surface interpret that as 50% of enrollment, but in talking with some other districts, Spring Lake Park, White Bear Lake, Richfield, etc., they were interpreting that a little bit differently. So what we did is we had Wold Architect do a study of all of our spaces and apply a social distancing formula to our spaces. So what that looks like is if you take a box and you grid that box out with 6-foot diameter circles in spaces that could house a student in a room. So if you have counters, that doesn't count. If you have tables that are permanent, you can't count that. But if you put a student in a 6-foot space, that would be the maximum occupancy that we could have. And then from there, it gives us an idea of what our true capacity could be while still honoring social distancing within the classrooms. So we shared the results of that study with all of our principals at the school so they could have a sense of what their capacity for social distancing is in their building. And it is more than 50% enrollment, but we are continuing to work through how to apply that in such a way that, as families make their choices about what they want to do, we can determine how many students we can bring into the building. But our phase one is to really take a look at kindergarten, bring kindergarten back in, and then re-examine and see where we're at and see if we have additional capacity and resource.
So Randy, could I follow up on that the capacity? So what would be the typical class size for kindergarten, for example, if we did that 6-foot spaces in our rooms?
So I think it's the low 20s. So it's not that different from our current class size guidelines, but it is slightly lower than our class size guidelines right now, but it's not half of our class size guidelines. So just to be clear about that.
But I also, can I just chime in on that too, Ellen? I also want to say that the elementary principals, talking with Jody and Randy as well as we think about this planning, we are still, even if we're bringing in our full kindergarten classrooms, we are trying to think about how do we utilize kindergarten paras in order to keep those cohorts as small as possible. So if we have 12 kids in the space learning, the other 12 might be in some extended learning, some different outside play, or some different things going on, so that we keep those cohorts of kids still remaining small, so that our teachers can feel confident in coming back as we learn about all of this as well. So we understand the top point of the capacity, and as principals, we're really trying to think about ways to keep those cohorts still learning in small groups.
So I think I've had some questions about what we anticipate are how hybrid is going to look as far as class sizes. So what am I hearing from you? Was it 12 are you anticipating for elementary? It's about 12. Is that what I heard? Or is it up going up closer to Randy's mention of the full, going to 50.
So I think, Ellen, I'll jump in here. So at the kindergarten level, if we're looking at bringing a class size of 22 into the building, our planning is that on the back end, we have kindergarten paras who can also at the same time be engaged with activities with those students, maybe in a different space, like Katie said. So the class size might be 22 to 23, but we're trying to engage other staff to reduce that effective ratio inside that space when learning's happening. At the upper grades 1 through 5, we bump into that ceiling for the capacity limit pretty quickly because our class sizes are bigger. We might have 25 to 28 students in first through fifth grade classrooms, and if we bring all of those kids back, we surpass that capacity limit. So that's why we're looking at the cohort model for those upper grades, so that we can still bring the kids in, but we're still respecting those limits there. Depending on how many students, other dependent learners we bring into the building, we'd probably be in the upper teens to mid-teens for some of those class sizes.
Okay, so I guess I'm more confused than I was when we started, because I understood that our classes were going to be split by the alphabet. So a typical classroom, A to Z, half of them would be going on A day and the other half would be going on B day, and they would all be spaced out by 6 feet. So now what I'm hearing is that the class that we may be bringing into a classroom, a typical class size at a time. So I'm just trying to figure out, is that what I'm hearing, or am I confused?
So it goes back to that idea of we need to see what parents are going to choose, and we also need to see what our staffing model will look like. Let me give you just a little example. My fifth grade classes are right now at 27 and 28 at Countryside. If I split those classes into an A group and a B group, the first decision is how many of those kids have already chosen the virtual academy? Take those off the top. Now I'm still going to split those classes into an A group and a B group. In addition to that, though, if I look at one particular classroom, which I can tell you, one of my fifth grade teachers right now, if I were to draw a line after the L's and say the A through L's is this group and the M through Z's is this group, that particular fifth grade classroom has 8 kids in the M through Z part of their alphabet, just by chance, and the rest of the kids, 20 kids right now, are in the A through L's. So a piece to this is going to be, once we have student decisions by parents, we need to take a look at our classroom models and say how many kids are going off to the virtual academy. And then we will likely have to do some shuffles within our class, our current class lists, to make sure that we are balancing that A group and that B group, to be able to have those smaller cohorts in those classrooms. Typically at the elementary level, our kindergarten, first, second grade classrooms are our smallest groups of students. So as we start thinking about who can we bring in first, we're going to start with kindergarten. They need us the most right now. They need us in the beginning of the year. They need their teachers because they don't know how to do school yet. So that's why the kindergartners are so critical to us right now. We're going to start there, and then we're going to see, is there an ability for us to take a look at other groups? And based on our numbers, based on our ability to have that social distance in place, we're going to make sure that we're not adding something in or phasing a grade level in that is going to put our kids in a situation where the numbers just don't make sense. So I hate to say it, but we are at a point where we need to know what parents are going to decide. And then we're going to basically take all of our class lists and see how do we shuffle them to make sure that we've got kids in the right spot and in the right numbers.
Okay, so I understand how complex this is, and I'm aware of that, and I recognize the importance of trying to have smaller groups, smaller bubbles, so that if contagion happens, we can manage it. And also in order to manage the classroom and social distancing, especially with the little ones. So I recognize that, and I'm just also stating that I think that we as a district, the focus should be on trying to make sure those classrooms can be kept small and that the groups can be kept together. I'm a little bit less concerned with the alphabet, just as you said, Karen. I'm a little less concerned about the alphabet as I am about managing this. But the other thing I'm really concerned about is the golden class time that we know is out there. And part of what I just want to ask about is we're losing about 20% of our class time by not offering classes on Wednesday. And so I'm wondering if you looked into having alternating Wednesdays for our groups, having a 3-day week and a 2-day, alternating, so that at least some students would get 3 days of live instruction a week, and then the following week they might get 2 by alternating that Wednesday.
It is something that we talked about from a continuity standpoint, and at this time we decided to keep it consistent. It certainly is something we could continue to study and look at down the road. We know that it's hard to explain what a big ask this is for our teachers to prepare to teach really completely differently than they ever have before. And they did it in a very emergency way last spring, but now we're doing it in a very intentional, a very robust and thoughtful way. And they do need time, and they need to be able to collaborate with each other. And what we built is a schedule that's pretty consistent with how other districts as well thought about what their teachers need to be able to deliver a quality education program to students. And so we really feel like that time is critical for our staff.
So, and with respect to that, I would just mention, I am concerned about the capacity of the teachers, and I understand also that that there are ways that you could have team teaching, so only one is dealing with the virtual learning, or the virtual learning is the virtual learning that's being done by our academy, so that teachers really, a teacher could be not responsible for the the remote elements, so that all of their learning is done during the school day.
So Ellen, I appreciate that thinking, and I think we can keep talking about this, but I do want to just chime in that an education of a child needs to be really aligned and intentional. So the lessons that they're receiving from a flipped version as well as the in-person, it all has to connect. If it doesn't connect, it's not gonna connect in the child's brain either. And so teachers need to work together, and they need to have the most impact they can for kids that are in front of them. And so that means that the teachers need to be planning and executing the flipped lessons in a partnership with what they're doing in the classroom. It can't be completely separate, because then it's disconnected from the learning, and it's really not worth it in the end. So I have to say, we need to support our teachers, and we need to give them time to do this well. And I know our community has very high expectations, and we want to meet those expectations, but we have to give the teachers the support that they need. And we are planning a very robust, collaborative, and supportive model for the differentiation, for the flipped learning and those remote lessons for our teachers in the hybrid. And yet we also need these awesome, fabulous teachers to help us build that robust system. So it's all connected, right? And so the most important part is that we all understand all of this connectivity and that we support each other in this work. And that we also just let ourselves continuously improve in small and really meaningful steps so that we all can keep this work going and really be impactful for kids the way we already know how to be impactful. So I appreciate the conversation, and yet I really feel like at this stage of the game, we're putting forward the best model that we can for teachers and for students, in align with our transportation and in aligned with all the other parameters that we need to stay within in Edina Public Schools.
Okay.
Ellen, I'm going to throw it over to Lenny because he's been waiting to ask questions for a while. So, Lenny, go ahead.
Actually, Matt's been waiting for longer. So,
I don't even see him on the screen. I'm sorry.
I will give over some of my time to Matt.
Yeah, I've been doing jumping jacks over here. No, it's fine. Just two quick comments. Well, first, three things. First one is I appreciate the incredible amount of work that's going into this. And, there's a lot of background stuff that's not all captured in one evening session that people are circling up on with 30 people on the screen. So I just know how much work and comparison and collaboration is going on, especially between the buildings, more so than ever been required before. So thank you all for that work. Mm-hmm. The second thing I wanted to say was I appreciate the kindergarten being ramped up first for those needs you said. I'd also I'm going to say two things, and I don't need a response, is I think that first grade perhaps is the next most important one. Just thinking about the consideration that they had a shortened spring season and that reading continuum is so important. I'm obviously talking from a non-expert to experts, so that's why we don't need to have a debate about it. Also, just to yield time back to Professor Lenny here. And then the third item quickly is, and this one, I don't want to make this a requirement. It's just a consideration. Katie, what you were saying really resonated with me about the pods and the grouping and the responsibility being between both the teachers and the settings and also collaboratively. As you get into stages 2 and 3, Karen, and think about what do we hear back from the parents and what do the numbers actually look like? The home settings and the neighborhood settings can also be a really good sense of continuity and support. The A to L, M to Z example that you were just talking through, Karen, a few minutes ago as well, was meaningful to me. So I think one thing, as you put together the checklist of secondary support systems, some families or others might group into pods. Now, it's going to be impossible for you guys to get an email from one family that says, hey, can you shift all my advisories so me and 3 kids can be together? I know that, but I'm just trying to think about when you get to that third order layer of differentiating. So how many kids do we have? What exactly are we offering? And one thing to keep in mind, too, is for those people, we usually have 7 to 10 people on the school board feed. There's like 230 tonight. So for those people that are kind of looking at this for our first time, this is an initial plan. And this set of administrators and team leaders and staff will be constantly reviewing this and modulating it. So that is one thing to keep in mind. So on day 1 with no Wednesdays, as Ellen was saying, that might change on day 30, but it's the day 1. So I'm not making any asks necessarily for day 1, but I'm just saying my 2 preferences for consideration would be the first graders are next, if possible, for the reasons I stated about reading. And secondly, the thought around if there's a way to help home groups that want to collaborate to take a little bit more burden off of the teachers and professional staff. And I'll stop there. I don't need a back and forth. I know you've already thought about it. I just want to communicate those 2 thoughts. Thank you.
Just 2 quick things. Our first graders are our next, are that next group we're going to look at because they're next on the list. And we are already hearing from parents about how we can potentially support those learning communities out and about in the neighborhoods.
That's awesome. Thank you. Yeah. I'm not surprised. I just wanted to voice those 2 things. I know you're already attending to it.
Lenny?
Okay, so a number of the questions I had have already been answered, and others actually I think have to wait until we hear back from the parents about what their preference is in terms of virtual versus hybrid, because that makeup will determine whether we could have more days for first grade or second grade, whatever it might be. But it does obviously make sense to kind of roll out in a fashion that we can better control. So I don't have any current questions that have not been answered.
Okay, I think we'll.
Jamie.
Oh, I'm sorry.
Oh, I just wanted to see Jamie or Owen if they had any last questions.
I've got two quick observations. The first is, Karen, you had mentioned that you may need to have the flexibility to change the cohort size based off of the randomness of where last names fall in the alphabetical selection. I think that's a great idea. There's always the law of unintended consequences, which because in the fifth grade model that you used, that might there may be a family of L's that in one instance would be placed into the AA cohort, and then a third grader might end up being in the BB cohort. And families trying to schedule childcare and so forth, that might run into some complexity. So anyway, I don't even need a comment about that, but that just underscores some of the complexity that you're facing with this. The other question I have, and I don't know if we've brought this up, but I'm kind of getting the impression you would not welcome this, but is there going to be any ability to be fluid in the group that you're committed to? If you initially signed up for hybrid, 3 weeks down the line, could the family move to virtual, or could you go back again? Just quick thoughts about that. We do need to move on.
We actually have talked about this in a couple of meetings today, just trying to provide some clarity around that. And the initial thinking is that it would be much easier for us to consider a family moving or making a choice or a request to move from the in-person or the hybrid model to a little bit more restrictive due to a family need, maybe an illness or something along those lines. So we've got a group of administrators who will be putting some language to that so that we can be consistent in how we approach those requests as they come our way.
Thank you. I believe we're going to early childhood next. Is that right, John? Thank you, elementary school principals. I know you guys are working lots and lots of hours on this, and I really appreciate it.
Okay, let's shift to early childhood. But everybody should look at Randy Smazel right now. He looks like he could be a commentator for a golf tournament, doesn't he?
You stole my joke.
I'm outside for the first time today.
Okay, Leah. Hit it, Leah.
John stole my joke, but that was my opening. Good evening, Superintendent Schultz and Chair Allenberg and the rest of the school board members. I'm going to be pretty brief because I know that you still need to talk about all of the high school and the middle school as well. And so I know you've read the board report and can shoot me an email or a call if you have any detailed questions. We're really excited in early childhood that we think we're going to be able to do some face-to-face learning for our little 3-year-olds and our 4-year-olds. We are going to do really tight safety protocols. So think small groups, stringent cleaning. We're really going to use the cleaning protocols that our counterparts in Kids Club used this summer and very successfully at that. So we're really looking into doing that. We will continue our inclusion motto with ECSE, although I'm going to tag Lisa in a minute because she will be sure to speak a little bit more about that. And the biggest question that we still have on our plate, and like every other administrator has said here tonight, this is all sort of a moving target, right? We're just constantly reevaluating and replanning. And so we're really looking at our young kids and our families that come to school with those young kids. That creates a little bit of a concern because we have a lot more people in the building, and then there's that piece about controlling the environment. So that's kind of what we're thinking about. But in our parent education, because I know some of you have taken parent education, we're really excited that we had quite a bit of success with that online in the spring. And so we will start our year with that and then see again, like everybody else, where do we need to make tweaks? What changes do we need to make? And Lisa, do you want to say anything more just about the ECSE kiddos or that program?
Yeah, we just have an obligation to make sure that we're servicing our youngest learners birth to 3 in natural environments. So we'll be working with parents to determine whether that will be in-center appointment type therapy services, outside therapy services. And we actually were doing some really strong virtual parent coaching this past spring that we had a lot of positive feedback on. So we'll work with individual families to determine what's the best option for that family. And then we'll be collaborating with preschools and daycares in the Edina community as well as the Early Learning Center. But that will be further into the fall as those protocols come out to ensure safety if we're sending our special educators into those environments. So we'll follow all of the safety protocols and the guidelines from the Minnesota Department of Health and the MDE guidelines to do that. We're also looking at some smaller cohorts of students coming in that won't collaborate necessarily with our typical preschool classes, but we'll be doing services working with a special education teacher, maybe a speech pathologist and an occupational therapist in small pods on those AABB days as well. And once again, it will be very individualized to family needs. We work through the IEP process to determine how those services will look. So.
Okay, we have to take a 5-minute